Water-specific therapy frequently uses continuous movements to affect neighboring joints. This example shows the influence of a right hip intentional movement on the left hip joint. The model has to prevent the continuous movement and will stabilize the left hip. Jumping originally belonged to mental adjustment. Jumping also offers the ability to include large sagittal movements. Objectives are to facilitate reactive head movements, to work on dynamic stability of the shoulder girdle, to activate the lateral trunk flexor muscles, or to mobilize transverse movements of the spinal joints. Shoulder stability is trained using various principles of disengagement. Alternating leg movements change into symmetrical movements with a longer leverage. Also, the direction of leg and trunk movements in order to focus on specific muscular stabilization activity. Metacentric effects are used during transversal rotation control. These can reactively facilitate the feet dorsiflexor muscles or influence hip muscle activity. The example shows a hip mobilizing and a hip stabilizing exercise. Stabilizing activity is directed toward the hip extensors. Hallowik techniques are used intentionally and reactively, using counterforce activity when working with turbulence. This also incorporates eccentric muscle activity and rhythmic stabilization type exercises. The therapist disturbs balance with manual turbulence, not only during the turbulence, but also when stopping and the model loses her brakes. Activities become increasingly complex when various rotations are included in functional tasks. The video shows a chained sequence of breath control, gliding, reaching, rotating, pushing away from the wall, and opening hands. Timing is an important feature and is trained through manual cueing. Longitudinal rotation control takes place around the longitudinal axis, or midline of the body. This rotation is most important when in a supine position. In order to prevent problems with breath control, guidance starts at the shoulders before changing the support to the pelvic girdle. This version of combined rotation control consists of both sagittal and longitudinal control. It is used to achieve a supine position when losing lateral balance. First, the model is guided before she makes the combined rotation herself in a controlled way. The client is supine and controls all rotations with good alignment of the spine, hips extended, trunk symmetrical, and no lateral flexion or abductions. The therapist tows the client in a wake of turbulence when applying turbulent gliding. Simple progression and basic movement are the start of independent swimming. An obstacle course is developed to train proactive and corrective balance strategies. Ankle, hip, and stumble strategies can be trained in a safe and time-delayed environment. Multitasking is included, as well as principles from functional task approach. A variety of activities focusing on the upper extremity, lower extremity, and total body can be incorporated into an obstacle course.